Greetings, dear students. Today, we are going to look into one important module, which is case history taking. It's a very important aspect of your practical because it's something that has not having a definite methodology as such, as you would have seen in other practicals, but this needs a little bit of flow and a skill to elicit information from the client or the informant. Okay, so we'll look at the different aspects of case history taking one by one. All right. So, case history taking of a child is especially very important and quite different from the way we take case history from an adult. And that's because there is certain information which would be difficult for a child to answer. And also, there are certain information which only the parent or the caregiver or guardian knows about the child. Therefore, it involves a lot of information gathering from the informants predominantly. So, the first part of a case history would be demographic information. So, the demographic details, which includes the name, age, date of birth, the address, family information, such as what are the parents doing? Is the child living with the parents, or is the child taken care by another guardian or caregiver? All such information, including their age and their occupation, socioeconomic background, income, and all of that, okay, the relationship between the parents, all of that comes under demographic information. Secondly, comes the presenting problem. Presenting problem means what exactly the child's informant is here for. Why are they seeking help? What is the complaint? The chief complaint talks about what is the major or main issue that they are facing currently. Okay, so we will be asking the informant about what is the reason that they are seeking help, and also some kind of a referral source as to who sent them to the psychologist as well, whether it's a school teacher or a psychiatrist, can be anybody. Okay, the third part of it is developmental history, and that is very, very essential in order to identify what could be the reasons leading to a particular dysfunction or disorder that is happening currently. Okay, so it's a very crucial aspect, and most of the interrogation needs to be very, very clear in this area so as to get precise information, which makes your ability to diagnose a little bit easier. Okay, the first part of it is prenatal history, which talks about the time when the fetus was in the mother's womb. So you will be asking the mother specifically as to how was the development of the fetus during the 9 months of pregnancy. Okay, were there any other complications during pregnancy, or was the child and mother having any kind of difficulty, disorder, anything as such? Okay, it also includes prenatal exposure, which means was the child exposed to alcohol, drug, medicated, non-medicated drugs, or some kind of severe chemical in the atmosphere. Maybe they were living by very, you know, poisonous or poisonous gas producing factory, things like that. Okay, so that is prenatal exposure. Coming to the next point, birth history. Was the birth a normal one or a C-section? And were there any other complications during the birth of the child? Okay, now this also includes the height of the child or the infant at the time of birth, the weight, whether was it a normal weight or was it underweight, and also if the baby was a premature baby or was it a normal baby. Okay, the next thing is early milestones. So these are again very, very important aspects. We try to understand whether the baby was able to attain the milestones at that specific period of time or not. So when did the baby first crawl? When did the baby first sit down, walk? All of those. In fact, your language development, cognitive development, emotional development, most of these are also assessed in this particular point. The next one is medical history. So is the child having any current medical conditions? Is the child having, any problem, any disease, any kind of disorder that needs to be mentioned, or a chronic illness? So type 2 diabetes, for example, is a very common disease in children. Okay. So they might be having that, or whatever it could be. You need to interrogate and find out. And has the child anytime been hospitalized for a long period of time? Has the child had any surgeries, be it minor, major? Anything and everything that is significant needs to be mentioned. Is the child having any medications right now? And if so, what is the dosage of that medication and all of that? And finally, is the child having any type of allergies to medicines and any other allergies as well? Okay. Finally, we move on to developmental and educational history. So this talks about, again, specifically on how the child has been able to function in the cognitive aspects. Okay. So first thing is educational background. So currently, if the child is going to school, what is the grade that the child is achieving, or is the child being able to socialize with his or her peers? Is the child regular to school? How does he or she find the school atmosphere? All of that needs to be questioned in this point in time. The next one is learning disabilities. Does the child face any kind of difficulty in any subject, and how persistent is it? Is the child not able to develop or correct himself or herself if he or she goes wrong in any of the subjects? All of that needs to be assessed. Next is the speech language development. So, is the child able to mm, um, catch up on the different language aspects, and is the child able to speak as per the requirement of that particular age group? So, the speech and language milestones is also very important to understand if the child could be having any kind of learning disabilities. Okay. Next thing is family history. Uh, we are trying to assess the genetic aspects of this particular child. If the child has any heredity of any kind of a mental disorder, mental health disorder, or any other condition as well, so that we can conclude at the end with all the information that we receive. Okay, so that is psychiatric and medical history. Next is social environmental factors. Very, very important role. Whether the child is in a conducive family environment, and is the child going to a proper place such as a school, or wherever he or she is the environment conducive for the child's growth? Okay. You will also be inquiring about the different life changing events that could have taken place in the child's life, and any other stressor as such which could be present. And you will be drawing a genogram with what the informant says. So that's a small diagrammatic representation of the family history. Coming to the next point, psychosocial history. Now we are trying to understand the behavior and emotional components of the child. Okay. So does the child have any behavioral issues significantly seen over a period of time? For example, the child is showing some kind of resistance to mingling with the peers. Okay, that could be a behavioral issue. Or is the child having any aggression issues? Child is always throwing tantrums, not listening, disobeying. Or is the child even having some kind of sleep disturbances? The sleep cycle is improper. The child is not having a proper cycle of sleep at any point in time. All those fall under behavioral issues. Up next is emotional well being. So, is the child having a stable emotional state? Or is the child being too overly sensitive? If so, what is the reaction to such an emotional outcome? Or even to talk about the general temperament of the child. How is the child in terms of his or her emotional state? And the next is social development. We discussed this already. So, how is the child in terms of talking to or interacting with his or her peers and other adults? Okay. Next one is educational and behavioral assessment. So, this is to ask whether there were any observations as such from the teachers or from the child's other caregivers or any other professional whom they have been to earlier. Any significant observation that should also be noted down. And if there were any interventions that were being administered over this child in the past, that should also be taken from the parents or the informants, because we need to understand whether the diagnosis was correct and whether the interventions worked with the child. If it worked for a period of time and then it stopped working, we need to understand why it stopped working and then modify accordingly. Okay. Finally, you come to a conclusion which is known as the provisional diagnosis. Okay. Provisional diagnosis is nothing but what is your diagnosis over all the information that you have culminated. Hmm? And once you have a diagnosis, suppose it's ADHD, or based on the symptoms, it looks like autism, you write that, and then there's a treatment plan that needs to be created and structured, which is very, very subjective and can be different for different children. Okay, one treatment plan cannot suit every child's needs. So it needs to be carefully looked into and created. After which, interventions, how many times the child has to be brought to the clinic or place for the behavioral therapy to take place, or what are the different types of visits the child needs to make to the clinic along with the parents or the guardians in order to make sure that the child gets to be in a better state of mind and in a better environment. Okay, so this is it. That's about case history taking. It seems quite simple, but it lies in the skill of each and every psychologist who can elicit maximum information from the parents or the guardians or caregivers in order to make a better prognosis and also a better diagnosis of the child's mental health. Okay. Thank you for listening, and I will stop sharing the screen. If you have any doubts, please get back to me as soon as possible. Thank you.